that is dedicated to skincare. We are here to enjoy an hour experience of skincare. We are here to talk about skin. We are here to share your myth. We are here to respond to all your questions, your complaints related to the skin. This is Z101.9 FM, your lifestyle, leisure, and radio, business radio. You can also stream us live on radiozmultimedia.com. Follow us on Instagram, Facebook, and X at ZFMGH, TikTok, and YouTube, also at Z Multimedia. Now, there's so many complaints about dark skin, hyperpigmentation. There are so many complaints about how to treat hyperpigmentation. And interestingly, so many myths. We are here to talk about hyperpigmentation. We are here to listen to your testimonies, your questions, your reviews. You can send us comments via text. You can WhatsApp us on 0544 321 019. 0544 321 019. You can also call on the same number. Today is 21st of March, and we are still celebrating the Heritage Month as well. Stay tuned. We will bring you more, especially myth related to hyperpigmentation, as we go for a quick musical break. We'll be right back.
R.I.P. Daddy, what and the friendly that top one and Sakuta Bibiana Maye and Kodanka to a Sukono Mama Shamwama Musiefi. And the Mekana Yakebi Yabasu Yaswesi. Now Sonia Berman, the Berman, a Berman in your Sibe Game was a Bemini. Then I might one more time in this Akamuanka, Wama Yeme. Pomochiche, Frikono Mama Shamwama Musiefi. And the Mekana Yakebi Yabasu Yaswesi. Now Sonia Berman, the Berman, a Berman in your Sibe Game was a Bemini. Then I might one more time in this Akamuanka, Wama Yeme. Pomochiche, Frisomo Becassa Denchemua. See then I said we can what if he and any bed. Level number to no banco, Mechamako, Ojana so, I thought from Betty Dame from Bezayama, from Rabene Dame from Bezayama, anybody to be shed. Let's throw Mammy Kamuta. R.I.P. Daddy, watch me say, Mammy, Bohuna do to me, open me say, Pusiaka. FNF so ba beni betro mi kan aso ne no fone nyese betia to tra agrona mi pro nyese ma say na si se mi ni obi ani la fini moji me fe me si en ye damage abone pese wo ka uti na wa fe ne si a kire wo hweiye nipa nye hweiye onye su ye ye di etia to ne so me ba mo koko ejuma ni nyina na ma ye level na bedu no banko me chama ko ojana so atafo me de dame fo bezaya anybody to be shared. The Chumani na Ramaye. Level number to no banco. Mechamako, Ojana so. I'm from Medina from Bezaya. From Ramedina from Bezaya. Anybody to be shared.
In the heart of Accra, nestled in the vibrant neighborhood of East Legon and New Beacon, a 360 multimedia farmhouse emerged, introducing Z Multimedia. With a steadfast focus on lifestyle, leisure, and business, we set out to bring high-value oriented programs that captivate the taste and desires of our audience. From the captivating airwaves of Z101.9 FM to the dynamic visuals of Z TV and the innovative realms of Z Digital and the incubation of advanced technological knowledge at Z Tech, every facet of modern media is meticulously curated to engage and inspire. Also, let's not forget the new Finder newspaper, now under the Z Multimedia umbrella, delivering insightful journalism with a business focus. Join us on the journey where innovation meets inspiration, where lifestyle meets leisure, and where business thrives. Change is here. Z Multimedia, your lifestyle, leisure, and business platform.
Lakeside Estate is calling all business owners, institutions, and HR heads. Want to give your employees more than just a paycheck? Give them a place to call home. At Lakeside Estate, we're making it easy for companies to support their staff with beautiful lifestyle choice and affordable homes through flexible payment plans, staff financing, and mortgage options. Whether it's a 2-bedroom starter home, 3 bedrooms, or a spacious family home, Lakeside Estate has the perfect package for your team. Strong structures, modern finishes, and a vibrant community all are waiting. Let's partner together to give a lifetime value for your staff. Call our sales expert on 050-141-8622 or 050-859-8931 or visit lakesideestate.com. Lakeside Estate, quality homes for all.
Let's be honest, we all want more without paying more. That's why Melcom is giving you more for less. From groceries to home essentials, fashion, electronics, and more. You get quality products at the best deals possible. This is not a one-day thing. From 19th January to 17th March, the savings keep coming. So before you buy anywhere else, remember, Melcom gives you more for less. Melcom, your #1 shopping destination.
Z 101.9 FM.
So thank you for staying with us. Welcome back to the Derma Dialogue right here on Z 101.9 FM. I remain your host, Dr. Kofi Ansah Brifo. And it's time to share some myth about hyperpigmentation, dark spots. Some call it sunburns. Some call it PIH, melasma. We are here to talk about the myth surrounding hyperpigmentation. You can still send your comments or you can still send your questions. Any myth or anything associated or related to hyperpigmentation, let's talk about it. Now we are going through. So the first myth is scrubbing harder will remove dark spots. This is very interesting. So people think if you have dark spots or if you have hyperpigmentation, the harder you scrub, the easier it gets when it comes to removal of the dark spots, especially on the face. So some people use sponge actually. We are here to tell you, well, that remains a myth. That is not true. As we go on, we are going to explain how hyperpigmentation comes about. But from today, we are breaking down myth. So if you have dark spots or if you have hyperpigmentation, scrubbing it, whether harder, using a sponge or anything that you use, it doesn't necessarily remove the dark spots. The second myth is very interesting. So dark skin doesn't need sunscreen. So from today, you will understand after the end of the program or during the program, you will understand that in fact, when it comes to hyperpigmentation, the dark skin needs sunscreen more than any other skin type. The next one is hyperpigmentation only affects people with dark skin. So again, yes, we have different skin types. We have what we call the Fitzpatrick skin classification. The longer or the higher you go, the higher the melanocytes or the melanin in the skin. So dark skin, yes, we have lots of melanin. So that's the reason why we end up getting worse or the severe version of hyperpigmentation. So all skin types they are all, they are all prone to hyperpigmentation, but it's common in the dark skin because of how active our cells, melanocytes, or how active our melanocytes are. So we end up getting more cases of hyperpigmentation. The next one, it's almost everywhere, and that's the reason why when people have hyperpigmentation, they buy all sort of creams. They buy, toning creams, they buy bleaching creams, they buy whitening creams, brightening creams, and you realize sometimes you are getting, the whole area is getting lighter except the dark spots. So there's a myth about, it says bleaching creams will fix hyperpigmentation quickly. Unfortunately, this is not true. So bleaching creams doesn't fix hyperpigmentation quickly. It only makes the treatment worse. So you realize that the whole area gets lighter. Unfortunately, where you want the cream to work most, that's the dark spots. Those ones remain obvious and it becomes more pronounced actually. So the last one is hyperpigmentation is permanent. So we are here to tell you hyperpigmentation is never permanent. With a very effective treatment, staying away from all the things that makes it worse, treating the cause, they're now actively, treating it. I mean, today's topic is one that affects a large number of people, especially in our part of the world. So the next 25 minutes, we are actively going to talk about hyperpigmentation. But you are reminded to send your questions on WhatsApp 0544 321 019. So now, what is hyperpigmentation? Very interesting topic. Hyperpigmentation, some people call it dark spots. Some people, others call it sunburns. Some call it dark inner thigh or underarm, darkness. So all these amounts or all these are classified as hyperpigmentation. Now, hyperpigmentation simply means darkening of certain areas of the body compared to your normal skin tone. It is not a disease on its own, but it is just the response of the skin. So the skin's response is to injury, basically. Now, think of it as the skin overreacting by producing more pigments than necessary. This pigment is what we call the melanin, which is produced by some cells called melanocytes. Very interesting cells. So if you understand how the melanin are produced, then you understand why some people, or in some scenarios, you realize the area gets darker than others. Now, why is hyperpigmentation common in dark skin? Very, very, very interesting. First of all, the dark skin or skin of color, it has a high melanin activity. So melanin is more like a pigment. That's what makes us dark, if I should put it that way. So people with dark skin, naturally, they have more active melanocytes. Melanocytes are cells that produce melanin, and that's a higher, baseline melanin. There's a high baseline melanin production. It also means the skin responds more aggressive, when it comes to injury. There's a memory of, inflammation. So the skin responds to inflammation more aggressively. And also any irritation that happens on your skin, no matter how small, can trigger pigment production. Irritation from acne or pimples, from insect bites, from rashes. sometimes from shaving bumps, and even just, friction. So you realize in between your thigh, sometimes you have this, darkening around there. Underarm, you have this darkening around there. Even some people, after some condition, eczema, some have intertrigo, especially the females under your breast or the groin area. You realize the place becomes dark. Now, sun exposure. Definitely on our part of the world, we are exposed to the sun, the UV light. And there's a very close relationship between the UV light and hyperpigmentation, or the UV light and melanin production. Now, the UV light, what it does is it stimulates melanin production, or melanocytes. So it makes them more active. That is the reason why when you walk under the sun for some time, you notice that you start getting darker. So you are darkening, or you get darker because you are producing more melanocytes, or your melanocytes they have become more active. And that's what happens. Now, we have certain skincare practices. Common triggers in our setting is some certain harsh scrubs. Some people are using very, skin bleaching products, or even steroid-containing creams. We can also have friction, as I mentioned earlier, on friction from tight clothes, from towels, from sponges. Now, what they do is they damage the skin barrier. And once the barrier is damaged, this leads to the pigmentation. However, we have other factors like hormones. So the classic scenario is somebody just got pregnant, and throughout the pregnancy, somewhere around the second or third trimester, you notice you become dark. So definitely we have a hormonal contribution, or hormone contribution to hyperpigmentation as well. Now, melasma, pregnancy-related pigmentation, and these are all visible and persistent in the darker skin tone. Now, we need to talk about the types of hyperpigmentation. The common one is what we call post-inflammatory hyperpigmentation. So then you have an acne, or you have a rash, you have eczema, or you have razor bumps, any kind of rash. And after the rash is gone, you realize the whole area becomes dark. Or the classic one is you have acne, or you have pimples, and sometimes we squeeze it. So the squeezing would definitely lead to inflammation. Once there is inflammation, inflammation also leads to high or more production of these melanin. And that is what happens. That's the reason why anytime you have pimple, or anytime you have acne, once it goes away, you notice the whole area becomes dark. The second most important one is what I spoke about, the frictional, pigmentation. So then the tight clothes, for instance, or then we are putting on weight. So it is more common in intertriginous areas. So then some people, the groin area, the underarm, or even the inner thigh. So you notice these are the areas that you start producing lots of melanin. Once the melanin, comes about, or you are producing more, the whole area gets darker. And that is hyperpigmentation that we are talking about. So all these conditions, or all these lifestyle, leads to the production, or leads to you having hyperpigmentation. Sometimes even the use of these strong steroids, these potent steroids, leads to these hyperpigmentation. And that is why we are here. If you just joined us, this is the Derma Dialogue, and we are talking about hyperpigmentation, dark spots. Very interesting. Tends to be very common in our skin type. Any condition, especially if you have a rash, because of our skin type, you end up producing dark spots or hyperpigmentation. And most of the time, in an attempt to manage or to treat it, we make things worse. So that is why we are talking about hyperpigmentation. You can send your questions on WhatsApp 0544 321 019. You can also follow us on Instagram. You can actually stream us live on radio.zmultimedia.com. let's talk about hyperpigmentation. We are here to hear or to listen, to respond to all your questions. We are here to also know about your testimonies, reviews, comments, everything. Send it or text us on 0544 321 019. We are talking about hyperpigmentation. Now, when it comes to hyperpigmentation, you can also have drug or chemical induced pigmentation, very common. So the classic one is, again, the steroid misuse or these cosmetic abuse. So there are certain skincare products that when you use for a long time, you end up getting hyperpigmentation. So the classic complaints that we hear in the consulting room is sunburns. So these days, people come and talk about sunburns. So sunburns, basically what it means is there is this darkening on the temporal part of the face. So the closer to the eye area, you notice the whole area gets darker. And there are times when they are using very harsh products that is lightening all the other part of the face except those areas. And in an attempt to treat it, they buy all sort of product, especially with the toning ones, the brightening ones, the whitening ones, in an attempt to, fade the hyperpigmentation or the sunburns. Unfortunately, it rather makes the whole area or the whole face lighter and now making the hyperpigmentation even more obvious. So we are here to tell you or to share how we manage hyperpigmentation. The first most important thing definitely is to treat the root cause. So it has to be treated. So if it's acne that is causing it, in an attempt to treat it, you need to be more interested in stopping the acne. Once the acne is gone, then we push or we spend more time treating the hyperpigmentation. Now, when it comes to hyperpigmentation treatment, sun protection is non-negotiable. So there is nothing like the dark skin or skin of color. We don't need sun protection, especially when it comes to hyperpigmentation. So definitely we need sun protection. Now, early dermatologist, visit. Most of the time, we use all these strong or potent steroids trying to fade our dark spots. And once you come, it makes the treatment a bit difficult, because what is happening is the moment you take the patient off the steroid, the classic or the common complaint you get is, "Doc, but I'm getting darker. My face is getting darker." People are passing comments about my face. And I keep on telling them, well, the potent steroids cannot, or they are not used in the treatment, long-term treatment of hyperpigmentation, no. And the more you use it, the longer or the more complications that you end up getting. So in an attempt to treat your sunburns, you realize it's now getting deeper, and now you hit to what we call, the exogenous or chronosis, either type, stage 2 or even 3. At that point, treating it or treating that hyperpigmentation becomes a little bit difficult. So, a very interesting one is the fact that now there are also some medical treatment. Yes, there are some procedures. Sometimes we do our chemical peels, we do our laser. And when it comes to the topical treatment, we have so many depigmenting agents, depending on, first of all, your skin type and what is causing the hyperpigmentation as well. But we need to avoid self-medication, especially with these triple action creams. So Fambact, Demeron, Sulfax, all these should be avoided when it comes to the treatment of hyperpigmentation. And most importantly, patience. Patience is key when you are treating hyperpigmentation. Hyperpigmentation cannot be resolved overnight. it takes time. It takes weeks to months to be cleared. It can never be cleared overnight. Then the psychological part of it. So definitely hyperpigmentation can lead to a low self-esteem, sometimes even social withdrawal and anxiety as well. So definitely that's the main reason why we are talking about hyperpigmentation. So we want to hear from you. You can reach us on WhatsApp 0544 321 019. You can also send your questions on the Skin Messiah live on TikTok. You can also join us, send your question there, and we are happy to talk about or to discuss hyperpigmentation. Now, let's talk about the mistakes that we do in the treatment of hyperpigmentation. So, a very common mistake is we buy very expensive harsh products, all in the name of fading or treating our hyperpigmentation or our dark spots. Now, when these products are used, especially inner thigh, it leads to stretch marks or it leads to striae. So this is the history. You have a history of dark inner thigh, and patient comes to see you. Unfortunately, the time you see the patient has lots of stretch marks. And mostly what is happening is very simple. It is the potent steroids that are usually found in these harsh products. They have destroyed the collagen. So the dermal part, the collagen is definitely being destroyed in an attempt to fade our dark spots. It has to be repeated. Now, especially striae, stretch marks in the inner thigh. So what happens is, once we are trying to treat these stretch marks or these dark spots, we buy products that have strong steroids in them. So sometimes they tell you, well, this is a soap. They have different kinds on the market. Now, once you start using, you realize with time, you start getting all these stretch marks. And these stretch marks, they are not as a result of you putting on weight, but mostly as a result of these potent steroids that are found in these harsh products. So mostly what happens is you end up getting striae or stretch marks as a result of you trying to fade your inner thigh hyperpigmentation or your inner thigh dark spots. Now, dark knuckles. This is one of the common complaints that we get as well. So we are always faced with, Doc, my knuckles are getting darker. And once that happens, we fall on bleaching or toning or whitening creams. Unfortunately, when we use these strong creams, everywhere around the knuckles gets fairer or lighter, except the knuckles itself. And there is a reason. So once you start using these bleaching creams, whether it has steroid or what they do is, first of all, they stimulate or it leads to the production of melanocytes or melanin at these areas are high. Secondly, it is not evenly distributed. Thirdly, the knuckles area, because of friction, so it is in constant or there is inflammation constantly happening there. And the next thing is, the skin there is thick. So once the skin is thick, the depigmenting cream that you apply, most of the time, you don't have enough going in there to cause the effect that we are looking for. So this is the reason why You can use no matter how strong or how potent the product is, you realize the knuckles keeps on getting darker. Sometimes dark knuckles may be the first sign of internal harm, especially when we use some of these products for a long period of time. So dark knuckles, yes, cosmetically, not only are we interested in clearing it, we are also interested in finding out whether there is any organ damage as a result of this rich history of these potent creams or these harsh products. So definitely there is the need to move away from harsh products. Now, there are times when you have PIH. So PIH is post-inflammatory hyperpigmentation. So the classic presentation is the person had acne, or the person had, especially in kids, they have what we call papular urticaria. So all it means is, because they have a sensitive skin, anytime they use, or anytime they have an insect bite, they have these strong, or these itchy rash that appears on their legs. So it mostly appears on exposed areas. So on your legs, your hands, but mostly on your legs, because most of these insects are low-flying insects. And what happens? After they are gone, so it leads to this very itchiness, especially at night. Sometimes they are sleeping and they are scratching. Sometimes it's bleeding. Sometimes even fluid comes out. It can easily get infected as well. So what you see is these hyperpigmentation, or these spots on their legs. Now, mothers, parents, or caregivers, in an attempt to treat this, they go to the market and they get lightening product, or in an attempt to fade these dark spots on their wards, legs, or even hands. But mostly what is happening is you realize the leg itself starts getting fairer, but the dark spots never fade. It even becomes more visible and making it even difficult to treat. So anyone listening, if your child has these dark spots secondary to eczema or sensitive skin or insect bite, or if you are listening and you have razor bumps, anytime you shave, you notice the beard area starts getting darker, or it has become dark. Or if you have pimple, you have acne, and there is this hyperpigmentation. Sometimes we are even more interested in the hyperpigmentation than the acne itself. What we are here to say is, we are here to share with you that toning or bleaching creams, they are not long-term treatment of these hyperpigmentation or of these dark spots. We need to avoid them. And once you avoid them, sometimes all you need is a moisturizer and a sunscreen. And you need to understand that it takes time. It takes time. When it comes to hyperpigmentation treatment, it takes time. It never goes overnight. So it has to be avoided or devoid of anything that makes it worse. So if you are treating hyperpigmentation or dark spots on your face, you need to protect your face from the sun, because the sun stimulates or produces more melanin, which makes the spots darker. So irrespective of how effective we are treating the hyperpigmentation on our faces, as long as it's been exposed to the sun, it keeps on getting worse. So the cycle needs to be broken. And once they are broken, you realize that the hyperpigmentation fades nicely and we are good to go. So if you just joined us, this is Z 101.9 FM. This is the Derma Dialogue. And we've been talking about hyperpigmentation in dark skin. Some call it dark spots. So we are discussing dark spots. We are talking about dark knuckles. We are talking about PIH, or post-inflammatory hyperpigmentation from acne or pimple. Now, there's a very interesting picture that I've shared. If you are watching us or streaming on radio.zmultimedia.com. Now, you see hyperpigmentation around a person's cheek. So we have different grades. So this is a very severe form of hyperpigmentation. This is a patient who took some medication and had this. So that's what we call the fixed drug eruption. So this is just hyperpigmentation. Now, we effectively treat this with these three main things. So the first most important thing is definitely you need a good moisturizer. You can't treat hyperpigmentation without a sunscreen. So in his case, yes, he was given a sunscreen and also a depigmenting agent. So depigmenting agent, basically what they do, we have different form of it. You can do your tretinoin, and you can do your azelaic. You can also do alpha-albitine, medically approved hydroquinone. All these are depigmenting agents. Now, just that some of them we don't use for a long period of time. Hydroquinone, for instance, you can't use it for a long period of time because it has a rebound effect. So in this case, the most important thing is the sunscreen, depigmenting agent, and the moisturizer helps the depigmenting agent to really get soaked or to enter the skin. And that is what happens here. And again, anything that makes this worse, as I said, you need to move away from it. So this is hyperpigmentation treatment of the face. And you can see the results. You realize the whole area has faded it nicely. And as I said, this was achieved between 8 to 12 weeks. So hyperpigmentation treatment needs patience. Anytime you hear or anytime you have hyperpigmentation, you need patience. There's a second picture, very interesting one. So this is what we call PIH. This is a lady who had acne. Unfortunately, she had used steroids. Now the steroids, what they do is, in addition to yes, you having a rebound effect, yes, because of anti-inflammatory property, it calms down the acne. But you realize that after it goes away, all the hyperpigmentation or the dark spots, they get a little bit exaggerated. And that's where the problem is. So in her case, the first most important thing we did was to stop the steroid usage. Secondly, sun protection. Because once you are using a strong or a potent steroid, organic product, what they do is it affects the skin barrier. So the skin barrier is supposed to protect us. So once your barrier is broken or is damaged, it has to be repaired. So you need to protect the skin from the sun. The sun on a broken skin barrier makes hyperpigmentation treatment difficult. So it has to be repaired. Sunscreen is non-negotiable. You need a sunscreen. Even when you do your procedures, you do your chemical peels, you do your laser, you still need your sunscreen. Now, let's talk about sunscreen usage. People use sunscreen only in the mornings or once a day. No. And there are times when they tell me, Doc, but I am indoor. Why? I don't step out. Even when I step out, I'm in an air condition. My office, I hardly step out. When it comes to hyperpigmentation treatment, if you want results, you need to apply your sunscreen very well. I use the 8-11-2 p.m. rule. So 8 a.m., you apply your sunscreen, then it's reapplied around 11 a.m. Then 2 p.m. By 5 p.m., the sun is nowhere to be found. So then, in terms of the UV light effect, it's very minimal around that time. So sunscreen is a must. Obviously, and the SPF that we are looking for, anything more than 30, but preferably 50. Anything more than 30, but preferably 50. With those ones, you can achieve a very effective treatment when it comes to hyperpigmentation. So yes, hyperpigmentation can be treated, but we need to find out the cause. And secondly, sunscreen is a must, especially in people with oily skin. There's what we call the rudem. Rudem definitely does the trick. So in this case, for instance, all that she did was to avoid the steroids, do very high level rudem sunscreen protection, then also a moisturizer. And in the evenings, we were just doing, tretinoin. Sometimes you do your azelaic, but it has to be done in bits. So what you see there is a sunscreen. So definitely sunscreen is a must. It's non-negotiable when it comes to hyperpigmentation. If you have an injury, let's say you had a procedure, you went for your skin care or any procedure that you might have had, the most important thing is you need a sunscreen, because at that point there's an inflammation, and inflammation leads to the production of lots of melanin, or it makes your melanocyte active, which leads to hyperpigmentation. So it's very important that in an attempt to any wound or any form of injury that we are treating, we need to also treat, or we need to protect the skin with a sunscreen so that we don't end up with a very severe form of hyperpigmentation. So we've been talking about hyperpigmentation. We've gone through what it means. We've discussed what causes hyperpigmentation. We had a very interesting myth. We've also discussed how we can manage hyperpigmentation. And we are here to also respond to your complaints or your questions. So kindly send us questions on WhatsApp 0544321019. Then you can also call on the same number. But we are here still discussing hyperpigmentation. Stay tuned. We'll be back to answer your questions. We are off for a quick musical break, and we will be back.
Street circle, still with them.
Dr. Kofi Ansah Brifo, your host, and you are listening to the Derma Dialogue, where we talk about skin, anything related to skin. We are here for all your skin concerns. This is Z 101.9 FM, your lifestyle, leisure, and business radio. You can also stream live on radiozmultimedia.com. You can follow us on Instagram, Facebook, and X at ZFMGH, TikTok, and YouTube at Z Multimedia. If it's your first time here, this is the Derma Dialogue, where every Saturday, 6:30 p.m., we talk about your skin concerns. A very important part of skincare is education. Sometimes the problem is not that the product is not working, or the problem is not from the product, but it's just the usage, or it's just understanding what the condition is about and how to treat the condition. So this is very important, and Z Multimedia has partnered Skin Foundation Africa. Every Saturday, 6:30 p.m., we bring you the Derma Dialogue. Today, we have been discussing hyperpigmentation. We have been talking about dark spots. We have been talking about inner skin thigh, or inner dark thigh. And we have been discussing causes, or what makes hyperpigmentation worse. This is what we are talking about. And now, because you matter, because your skincare, or your complaints matters, we are here to discuss some of the questions that you sent us. So we'll start with Nana K. Nana K wants to know, what is hyperpigmentation and what causes it? So hyperpigmentation just means a darkening, or an area of your skin getting darker than the natural, skin complexion. Just that sometimes, because the skin complexion has been altered, you can't tell which one is a normal skin or which one is the affected one. But definitely, when it comes to hyperpigmentation or dark spots, certain areas get darker. The causes are a lot, but the common cause is pimple or acne, where people are getting hyperpigmentation or post-inflammatory hyperpigmentation after the acne. So you notice that you